with my patient's chart. I know I need to do a head to toe assessment on her. I know I need to get my box of supplies and stuff. I've got my stethoscope. But what I'm gonna do is go ahead and set out. I'm standing outside the room. I'm gonna go ahead and grab her bedside table and set everything up out there that I'm gonna need so that I don't forget what I need to pull out of the box. So, the next thing I'm gonna do is knock on her door. Knock, knock. Hi, my name is Jan. I'm gonna be your nurse today until 7:30. Can you tell me your name and date of birth?
Kristen Box 987.
Okay, and I'm looking at it right there on her wrist. Is it okay if I call you Kristen?
Sure.
Okay. Hey, I'm gonna be washing my hands, but I'm gonna kind of let you know what I'm gonna be doing. As I'm washing my hands, I'm gonna be checking you today. I'm gonna be checking, listening to your heart, lungs, checking your pupils, things like that. Having you get up and kind of walk and do some movements and stuff. It won't hurt or anything like that, so take me about 30 minutes, okay? So what I'm gonna do is, I've washed my hands, I'm gonna raise your bed up to my height. I already got your vital signs and stuff. As I walked in, my patient looks well groomed. Nutrition-wise, she is not malnourished. Her affect, she's following along with my conversation, responding appropriately to my questions and information. I provided privacy so that we can start the assessment. So I have a couple questions for you. When you get in the car to drive, what's the first thing that you do?
Put on my seatbelt.
Great. Do you text when you're driving?
Never.
Oh, great, great. Do you know where you're at?
I'm at Marian University.
And do you know what the date is?
That's a good question.
Okay.
June 7th.
Yeah, you did it. Okay. You know the time. Okay, so oriented, alert and oriented times 4. Can you tell me what you had for breakfast this morning?
An apple.
Oh, you should eat a little bit more.
Now it's running late.
Okay. And when was the last hospitalization?
When I was 7.
Okay, so short and long term memory is in there. We've also, her speech is very fluent. She's not having any trouble with rambling or anything like that. I'm gonna hand you this article. I'm gonna have you take it with your right hand, transfer it over to your left hand, and hand it back to me. Thank you. And cognition is great. She was able to learn a new task. The other thing I'm going to be doing is checking to see if you have any pain anywhere.
No.
Okay? Because I'm going to be checking your range of motion and stuff. Okay? So first thing off, I'm looking at her. As I walked in and stuff, I noticed that her face, her eyelids, eyebrows, and everything are in symmetrical with her face. Her nose, there's no deviation, no disformation of the nose. Looking at her ears, they're in alignment with the head. The head itself, I've got gloves on. Head is a normal cephalic. Checking the hair, oh, nice distribution, clean, healthy, texture soft. There's no vermin, there's no scales, no lesions or anything in there. I'm not feeling any bumps or anything. Coming up forward here, kind of checking the auricle, coming down. Any pain, any discomfort? Nope. Okay. So looking in there, both ears, looking in the right and the left side, kind of pulling the kind of up and back, and there is no wax buildup in there or anything like that. I've got my otoscope, I'm looking in there, and at the right, I see the cone of light. At 5 o'clock, tympanic membrane is nice and shiny. Checking over on the left side, I'm gonna find the tympanic membrane gray and shiny, pearly, and the cone of light at 7 o'clock. I'm going to now be kind of, can you Can you do me a favor? Can you pull your, yeah. Okay, so I'm looking in here. Sclera was white, conjunctiva. There was no redness or anything. Gently palpating, any discomfort. Sinus up here, frontal, and this is the maxillary, and no discomfort. Checking the palpating the lacrimal glands, no swelling or anything with that, and no redness inside the teardrop area or tear duct area. Lashes are thick, eyebrows are thick, beautiful eyes, irises are blue, bluish gray. And I'm gonna take my pin light here. I'm gonna have you look straight ahead. Don't move your head. I'm gonna come in. I'm shining the light. Pupils was 3 millimeter, went down to 2. Coming in on this side, pupils 3 millimeters went down to 2. So Perla equal active, reactive to light. Check the sclera, everything up in there. I'm gonna have you look right at my pin, and I'm gonna do some movements with it. And can you tell me, or let me know if you have any problems with it? Okay, so we're going up, 6 cardinal gazes, down, and coming in. So that covers the ocular motor, cranial nerve 3, 4, and 6. So we got ocular, trochlear, and adducens. And then also when I checked was the oculomotor with the Perla and stuff. Snellen chart. Hold this straight away from you and tell me, cover one eye and tell me which it's lowest line you can read.
374258.
Okay, perfect. I would have her do it with the other side and cover the opposite eye. And that one. Back with my pin light, I'm coming in. I'm gonna have you tip your head back, looking up in there. No bats in the cave. Mucosa is pink. There's no redness, no deviation of the septum. I'm gonna have you close your eyes. I'm gonna put something underneath your nostril. Plug one side of your nostril and tell me what you smell.
Alcohol.
You're actually gonna do that.
Okay, great. I would test on both sides of that. So that's cranial nerve number 1, olfactory. While I'm right up here, I'm gonna have you take your left ear, take your finger and keep tapping on the on your ear, and I'm gonna whisper a couple words into your on this side and let me know what you hear.
Coffee cupcake.
Okay, and I'll check it on the other side. That's cranial nerve 8, and that is her auditory acoustic nerve. I'm gonna have you smile, frown, and raise your eyebrows. Oh, great. Cranial nerve number 7, and that's facial. I'm gonna have you open your mouth. I'm gonna be looking in here. Raise your tongue up, okay. Looking at the gingiva, I'm looking at her teeth, the mucous membranes, everything's red, they're in pink. No redness, no bleeding or anything like that. Teeth are intact. I didn't see any denture or dental work or anything like that. Stick out your tongue. Open your mouth, stick out your tongue and say ah. Okay, checking the cranial nerves 9 and 10, hypoglossal, and also the vagus, the uvula, and soft palate rose. Looking in there, I didn't see any problem with the tonsils swollen or anything with that. Okay, moving on down, lips, I'm looking at those. There's no cracks, there's no lesions or anything. They look moist. The tongue was pink, moist, and no white drainage or anything like that on it. Since I'm right here around your neck area, I'm gonna, well, you know what? Shrug your shoulders for me. Okay, great. Checking cranial nerve number 11, and that's the spinal. Coming back here, I'm gonna check for my your lymph nodes right now. I don't expect to find anything, but I'm just gonna palpate here.
Okay.
So coming in, I'm gonna do pre-auricular, post-auricular, coming on back, occipital, coming forward. I'm gonna do posterior cervical chain, coming on up. I'm gonna do superficial cervical chain, up a little bit higher, jugular digastric, coming down. I'm gonna get into the deep cervical chains here. Coming forward, I'm gonna have you open your mouth. Okay. Checking TMJ, which is cranial nerve number 5. There's no popping, clicking. Coming forward, submandibular. Coming on forward, submental. Can I have you shrug your shoulders a little bit? And coming right in there, supraclavicular. Okay, no swelling noted in the lymph nodes, which I shouldn't have been able to palpate any of those. I'm gonna have you look straight ahead, swallow for me. Okay, trachea is midline. And then I'm gonna also palpate. I'm gonna shift over to the right, palpating on the left side for the thyroid, shift it over, and palpating the other side, and fill any nodules or anything with that. So coming on down, I'm gonna be listening to your heart now. Okay? So let me know. I'm letting you know it will take me a little bit, but it doesn't mean anything's wrong. Okay. So, standing here, I'm inspecting. I don't see any pulsations or anything like that. I don't see any discoloration of the skin, no bruising or anything like that. I'm going to let you know, the heart sits mainly on the left side. The second intercostal space, it starts out on the right, a little bit on the right side at the second intercostal space. It goes all the way down to the fifth intercostal space. I'm going to listen to your heart valves. Okay, second intercostal space is the aortic on the right, second on the left is pulmonic. Third intercostal space is the Erb's point. That is where I can hear S1 and S2. S1 is the lub, S2 is the dub, and this is where I hear the closing of the AV valves and the semilunar valves. Coming down fourth intercostal space is going to be the tricuspid. Around fifth intercostal mid-clavicular line is my mitral valve. Also, that is where I can palpate the apical pulse. So that is a +2. Coming back up, I'm going to go ahead, since I already listened to your heart, I've got all of your valve sounds done. I'm going to check pulses, temporal, check them both bilaterally on both sides at the same time. Carotid single, carotid, checking that. Coming down, brachial. Checking right here is the radial, ulnar, switched it back there, femoral, popliteal on both sides, coming on down, getting the tibialis, and dorsal pedals. Okay? Pulses are 2+ bilaterally. Checking the skin a bit as I've been going along, feeling the temperature is warm. There is moisture, it's dry, it's not dry, it's just nice moisture. I'm gonna check trigger here on all extremities, and it rebounds, goes, elasticity goes back down as soon as I pinch it up. I'm going to be also looking at checking for any edema, ankles too, checking capillary refill on all toes, on all fingers, looking at the nails. I'm going to have you put the nails together, looking for the shape, nails 160 degree, looking at the angle of them, it's not biting the nails or anything like that. Color is appropriate for anestheticity. Now we're gonna go ahead, I'm gonna listen to, I'm gonna ask you 5 questions. Okay, or ask you a couple of questions. Do you, uncross your legs for me? Okay, can you raise up and try and move my hands? Okay, checking for muscle strength. Can you straighten out your arms? Can you push against me? Try and raise my hands up. Okay, muscle strength. Crossing my fingers, grip strength. Pull. Got it? Nice job on that. Okay, so she's wiggling her toes. I see her moving those. She's moved her legs. Can you raise and lower your right leg and your left leg? Okay. Can you flex up your feet and dorsal flex? Okay. So looking at, she's able to move that. No paralysis. Are you having any pain? You said no pain anywhere. No pallor because the skin is appropriate for elasticity. And do you have any tingliness, numbness, tingling, or anything like that?
Nope.
Good. So I address all 5 P's. Coming to my box right here, since I'm kind of just chilling and going through my system the way I want. I'm going to be doing some sensory checks. So I'm going to have you close your eyes. Okay. And don't peek. Don't peek. And then tell me, and turn your hand up. Tell me if you feel 1 stick or 2.
1. 1.
Okay. I'm going to do it on all 4 extremities. That's 2-point discrimination. The next thing I'm going to do, turn your hand up, close your eyes, and tell me where I'm touching.
My wrist.
And what do you feel?
Vibration. Finger.
And what do you feel?
Vibration.
All 4. And so I did that one, we got that. That one, checked on that. My alcohol. So I did 2. That's all I had to do was 2 of those. So I can put all of these back in my box. Okay. So I'm going to start doing your respiratory assessment. At this point in time, I'm only going to address the anterior. And then later when I have you set up, I'll listen to your posterior for your respiratory. Okay, so gonna go 5 areas. Inspiration, expiration, move my stethoscope. Up here, I'm gonna be catching the bronchial breath sounds. Right in the middle, bronchiovesicular, coming down and out and around. I'm gonna get vesicular breath sounds. I'm looking at the chest as I'm moving my stethoscope. I do not see any use of accessory muscles. I don't see any nasal flaring, no signs of distress or anything like that. Also, when I'm watching her, I'm looking or inspecting for any bruising or anything again on the chest, which I did with the cardiac system. To know that. I could go ahead and check a chest expansion here, which goes back and forth, and I check for that. I could do some percussion up here, and I would be getting resonant as I'm doing that with the respiratory system. I could also palpate. Could do the tactile thermometer, but it's easier to catch that on the backside. Okay, so next thing I'm gonna do, I'm gonna kind of lay you back, okay? I'm gonna provide warmth, might turn up the thermostat a little bit more. I'm gonna ask my patient when her last bowel movement was. Yes, okay, great. I'm going to make sure that she's covered appropriately. Knees are a little flexed here. And I'm going to have the drape up to here and her gown up to here. So all I'm looking is at, and I'd have her lower. Do you mind going lower? Some patients you might not be able to do this, but okay. So I'm going to be inspecting. I'm looking for any striation. I'm looking for any scars, any lesions. I'm looking for any hernias, any pulsations, and I do not see any. Her abdomen is contour, is not distended or anything. I'm going to start out now auscultating in the right lower quadrant. In this right lower quadrant is the ileocecal valve, and that's why I'm going to start here, because this is where the vowel sounds start. Gonna listen for at least a minute, and once I hear something, I'm gonna move up to the right upper quadrant. Listen again. Within 10 seconds, I heard something. Moving over to the left upper quadrant, I hear vowel sounds. Within 15 seconds, moving on down to the left lower quadrant, I hear vowel sounds. Vowel sounds are gurgly. They're not hyperactive and not hypoactive. The next thing I'm going to be doing is percussing. I'm going to have Tiffany start out again, the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. I'm going to have Tiffany, for the most part, and dullness over the organs. Next, I'm going to start palpating. I'm going to do the light one is about 1 to 2 centimeters. And then when I go for the deeper one, that's going to be 5 to 8 centimeters. In the right lower quadrant, I'm going to get the appendix and the cecum. Coming up to the right upper quadrant, I am getting the liver and gallbladder. Left upper quadrant, I'm getting the descending colon. Left pancreas, and picking up some of the pancreas.
Spleen.
Coming on down. Oh, kidney, I could get up in here too. Her left kidney. Coming down, I'm getting the descending colon and also the sigmoid colon. Okay, so we got those areas. I'm going to have you relax your legs, kind of cover you back up. We've got the peripheral vascular, done all of that. The motor, the sensory, checked all the pulses. Tell you what I'm going to have you do, a couple of things for, I'll just wait till we get ready to do this. I'm going to have you go ahead, we've done the skin, checked everything, no lesions anywhere. Okay. I'm going to have you sit up on the side of the bed, and I'll kind of help you if you need it. I'm going to the posterior side. I'm going to finish up your cardiac, or your respiratory back here. First of all, I'm inspecting again. I'm looking for any bruising, anything like that. Checking the temperature of the skin and stuff is warm. I'm going to start palpating here. You let me know if you feel any tenderness or anything. No tenderness? Okay. I'm also going to be checking for any lumps or any masses. Next, I'm going to go ahead and have you, each time I move my hands, I'm going to have you say 99.
99.
Again.
99.
Again.
99.
Again.
99.
And again.
99.
Okay, great. Now I'm going to check that tactile affirmatives. Take a deep breath. Chest expansion, excursion there, and symmetrical. Looking at the spine, there's no curvature or anything like that, and I'm kind of palpating that too. But the main thing is to check with, make sure there's no sway or any problems with the AP, which is 1 to 2. So that means my patient's not having any problems with emphysema, COPD. Next thing I'm going to be percussing, comparing both sides, coming down, zigzag manner. And what I'm obtaining is resonance and hitting 9 areas with that. Next thing, I'm going to be auscultating. So I'm going to take my stethoscope. Every time she takes a breath in, out, I'm going to move over for a total of 9 rotations. Coming down up in this area, mid towards her scapula, I'm getting bronchial vesicular, and then coming on out to the sides, I'm getting vesicular. I do not have noticed. I have not heard any adventitious sounds, no wheezes, no rhonchi, nothing like that. So we got the AP 2-to-1. Have you had any problems with the kidneys recently?
Nope.
Okay, I'm going to be giving you a tap back here, so let me know if you have any pain or anything. Any
Nope.
problem? Costovertebral angle. I'm getting dry.
Yeah, it's a lot of talking.
Okay. So next thing I'm gonna have you do is stand up. Like you did. I'm gonna have you just kind of take a walk casually across. I'm looking at her posture is upright. I'm looking at her hips are in alignment. Her arms are swinging freely. Next, I'm going to have you come back heel to toe. I'm looking at her balance. She's not weaving or anything like that. You pass. I don't have to have the breathalyzer or anything.
That's good.
I'm going to have you turn around, kind of bend down, come back up, checking for scoliosis, and I do not notice any different spines in alignment. I'm going to have you come over here, close to the bed. I'm going to have you stand here, close your eyes. I'm checking Rumberg, and there's going to be, you're okay now, open your eyes. Going to be slight swaying, but not severe or anything like that. I'm going to have you do some hand coordination here. Faster, faster, faster. Okay, awesome. I'm going to have you do some range of motion for me. I'm going to have you flex, extend, flex. I'm going to have you circumvent. Okay, I'm going to have you take your shoulders and do that. Okay, your hands, supination, pronation. I'm going to have elbows, flex, extend. I'm going to put my hands here. Do you have any discomfort? Don't feel any tenderness, no warmth. And I'm checking all joints, and there is no crepitus. I'm going to have you take an adduct on both the hips and stuff. And then we've already done the dorsal flexion and stuff of the feet and things. So we got all of that. Okay. I'm going to have you, we've already checked that. Grip strength, I checked all that. So, I'm going to put your badge down. My hammer is right here. Get a whack in now. And check that point. I'm checking her patella. Oh, nice one. Perfect. I'm glad I wasn't standing there. Don't sit down in front of anybody. And then I'm going to take the bottom of your feet. I'm not going to do that because I'm nice. And I'm going to make my upside down J on you, and then your toes curled in. Okay. Well, Kristen, I really appreciate you letting me do all these assessments on you. And you know what? I've got your bed back down, opened back up your curtain. I gathered all my supplies and got them back in the box. Here's your call light. I'll be back in about an hour. If you need anything, let me know. Okay?
Thank you very much.
And so I'm gonna go ahead, take off my PPE, clean up everything, wash my hands, and the last thing I'm gonna be doing is documenting. What was my time?